How you doing, guys? So we got a patient here. He just wants one adjustment before she heads back to Holland over here. So you got an interesting case over here. So come a little closer up here. I'll show you guys. So what we see over here, see all these striations over here? So there's a hypersensitivity to cold weather over here, what we call Raynaud's phenomenon or Raynaud's disease over here. But it's typically limited to just the hands and the feet. But as we see, it's going all up, as far as up to her legs and up to her knees itself. And you also complain about the low back pain and also mid back pain and so many other fun stuff as well, right? Yeah. All right. So while we're doing this instrumentation over here, we're looking for any abnormal temperature. Our patient over here also shared another interesting tidbit. And you mentioned about you've been going to the bathroom very frequently, correct?
Yes.
How often do you go?
For example, right now in the last hour, I went 3 times.
So, wow. All right, so that's definitely frequent urination there.
Yes.
Got one right there. And where we see there's quite a bit of swelling here. You feel that speed bump here? Mm-hmm. Right? This is smooth over here, and yet there's a little bump right there, right? So we get that is what we call edema. The swelling over here, we only get that if there is a presence of a damaged disc. And that's what this is over here. So we press and challenge and test your 5th lumbar. How's that? Doesn't feel fun now, does it? Mm-hmm. Right? Yeah. Let's go ahead and let's check your foundation itself. So the left side is not moving whatsoever. Right side is. Right hip, fine. Left hip is moving fine. So how's this fellow over here? Tender?
A little bit.
A little bit here, right? But this one's more.
Yes.
All right, so we're gonna address that one first then. You're gonna check the rest of your spine. And we feel this one over here. That's not moving right. Everything is moving just fine, but this one is not. Position 2. You feel that right over here?
Yeah.
You have a swelling right here as well. So we're gonna mark this level. Position 2, this left side over here, the muscle's tight.
Yeah, that's...
This one's not so much, but this is.
That one's really bad.
You feel that, right?
Yeah.
You got a good old muscle knot right there? Mm-hmm. Check everything else above it. And you got another one that's stuck here. Feel that swelling right there?
Yes.
Yeah. And another muscle tightness over here. You feel that nice, beautiful knot right there?
Yeah.
Right? Look at that. It feels like the size of a cherry pit over there. Right? So we're going to mark that level as well. I tested that 5th lumbar. That one's in trouble. And already 6 out of 6 indicator shows, yeah, that's the one we need to correct. And because it got shifted out of alignment, that's why we see your whole entire spine, everything is tilted towards the right. Mm-hmm. That's why you feel lopsided and you're also experiencing some dizziness, all other not so fun, pleasant stuff. And that's why you see the rest of your spine is also unstable as well. So this is what we need to address first. We'll take another look, retest this structure over here and this one afterwards.
Looks a little better.
Yeah, because before it was like all of it.
Yeah.
But now it just looks like it's all starting to fade away just
yes.
right here.
Yeah, I can see that.
But your feet themselves, it's ready.
Yeah.
Starting to prove right there.
Yeah.
What about your hands? Nope, still there. Okay, round 2. Let's go. Let it all go right. Show and tell time. How's the hands?
Looks a little better, I think.
Okay.
Yeah.
Feel them? How do they feel?
Feels good.
Still a little. Okay. Yeah. So it's not as cold as clammy as before. It's still a little clammy on your palms themselves, but give some time to dry up.
Okay.
Right? But you feel the surface over here?
Yes.
Here, it's not as clammy as before.
No.
So it's magic time. So tell us, what happened to this one over here? You mentioned about the wrist pain.
I have, right now it's very tiny, but I have this thing on my wrist, and it's like Sometimes it's very big, sometimes it's like this, and I have this for like 4 or 5 years now.
So when we do this, right? See this one, the right one over here doesn't protrude. See how it sticks out on this one? On that left one. So let's go ahead, let's take a closer look, see what's going on. Check the radial ulnar. Check the elbow. Okay, elbow slightly loose. Not too bad. See, but that lunate, that's not in place. So we're gonna pump this up before we set this. There we go. Get a little more. A little more. Let it go. There it is. Now let's check. See that now?
Yeah.
It's not as protruding as much.
This one was bothering me yesterday, for example.
Oh no, which side?
Like both sides.
Got it. Let's test it. It's a little bit out. Yeah, you have a PX tibia. All right, let's go it. Let's get on it. All right, here we go. Okay, grab onto the top of the table. That's right there. And there it is. All right.
It feels like more flexible, maybe?
More flexible?
Yeah.
All right, let's test it. Yeah, it's moving now. It's fine. Let's take a look, another look for your hands. How's the hands now?
They look better, for sure.
Yeah. Right?
Feels better.
How's the palms?
Still a little.
Not as clammy as before. See,
No.
this is getting more drier. See,
Yeah.
it's still a little clammy and sticky here.
Yeah.
Let's take a look. How's the knees and the feet? Hey, look at that. See? Doesn't have that spider web appearance anymore.
Yeah.
Right?
No, it looks better for sure.
Oh, how do you like that?
Great.
All right, well, there's your last adjustment for the road there. Well, I wish you the very best. Safe flight back to Holland.
Thank you.
Oh, you're very welcome.